We are back once again with Dr. Brian Orr, pediatrician here in Gloucester and Cape Ann. We were speaking with him more often when COVID first broke out, but it's been a couple strains since we've had a conversation. So we'd love to catch up with you now, Dr. Orr. How are you doing?
Good, good. How are you?
Great. It's great to see you again.
Yeah, thanks for having me.
So it has been a while. So I guess right off the top, when we first spoke, even a couple of years back, the cases seemed to be pretty mild in your office, and then Delta happened. So can you sort of walk us through how your office navigated through that?
Yeah, so we had at the first string of COVID, it didn't affect kids very much. We had some cases, but it wasn't really a school and child issue. And the kids who were getting it were really doing pretty well. And then you're right, when Delta and then Omicron came along, and now it was whipping through families, whipping through kids. And so we've more recently have had whole families and getting COVID, and we've struggled at different points of this because testing was a pain and a problem. We had trouble accessing enough tests, even in my office, even in medical circles. It was really, we went through pretty much a nightmare of trying to being able to be fair to people who needed and wanted tests for their families who were getting sick. Even at one point, even hospital centers were limiting the number of tests they were doing per day. So we tried our best to keep up with the wave, and we were just like any medical location where COVID was happening in large numbers, we were bombed and we were really struggling to keep up. And families were struggling a lot with the worry and concern with it. So it looks like we're coming out to the other side of it. Thank goodness. It has calmed down really rapidly in the last couple of weeks. I'd say it dropped like a rock. And we're getting tests like crazy. We have tests everywhere. We're getting them mailed to us from the postal service. But now it seems like things are calming down.
Mm-hmm. So how sick were you seeing children get when at the worst of it? What were you seeing?
So most kids were doing pretty well. A lot of families had cold symptoms. So we didn't have a lot of kids going into hospitals or being hospitalized. There are certainly stories of kids getting very sick, and there are kids people at Children's Hospital will tell you, kids with other with diabetes or with other issues really could get very sick with COVID. In my practice, I didn't have many kids get very sick with the illness itself. I did have some kids who had a cough that lingered for a while. I've been seeing several in my office even this week that they had COVID in January and the cough is just not going away. I have not had a lot of kids with severe pneumonias or anything like that, but this kind of lingering cough. I've had some teenagers with some long COVID from the Delta variant in the fall, and their symptoms are just continuing with fatigue, and they're having a hard time continuing their work and school. So there are those cases. We've also had to look at and be aware of the myocarditis issue, and we've had to screen a lot of kids for that, because of chest pains or chest issues or even chronic cough issues. Especially athletes. People should be aware that athletes who had really significant symptoms with COVID really should be screened before going back to their sport for the myocarditis issue and chest issues. So we've had a fair number of those kind of things. The initial phase of it, most kids doing well. Occasional kids with longer coughs going on, some kids needing to be screened even after the vaccine for myocarditis. and then very few older teenagers with long COVID.
Mm.
So, and Dr. Orr, of those patients, did did those children have pre-existing conditions, or were they immunocompromised, or is there just hit or miss on how the virus lands with an individual?
They did not have pre-existing conditions. Thank goodness none of my kids who've had transplants or cardiac issues or diabetes, uh, they did pretty well. I did have some families with diabetes who got COVID, and fortunately they did well. They could have had really big problems. So the ones I'm talking about are not those. These are kids who, after COVID and the longer period of time having cough, no, they're healthy, thriving young adults, teenagers, and preteens, and they're still having some issues that we've had to rule out, the myocarditis or the long cough for about a month or so after having COVID. And then the long COVID cases, those are particularly troublesome because there's still a lot of mystery around it. These are teenagers that I have, and young adults, even 21, 22-year-old, and they are really fatigued. They have brain fog. They cannot function. They don't feel like themselves. And so there is a clinic at Children's Hospital that we've referred them to for the long COVID symptoms. And now there's some information that perhaps these people had mono in the past, and it's reactivated some mono symptoms. And so there's some things coming out about those long COVID cases, but it's still not really clear. So I'm handing those off to the experts at Children's.
Hmm. And how about the vaccine? How have families and kids, how receptive have they been to getting vaccinated?
My families have been fairly receptive, I would say, and thank goodness for that. I think it's very important to recognize that people have heard lots of wave of different, sometimes crazy things about the vaccine, and I have to say, without a doubt, the vaccine made a huge difference in this pandemic. People just don't get as sick. They don't need to go to the hospital as often, and they just do better with the vaccine than without. And fortunately, the families have been. They've already, many of them this week have been asking, when is the booster? When should my child get a booster? So they're even ready for the next step.
Hmm.
And at the time of this recording, Dr. Orr, we've learned that the state has given the okay to lift the mask mandate in schools. So do you think that's the right move at this time?
Well, that's a very good question. New York lifted the mask mandate for businesses, but not schools. And so, it is okay in different areas to do different things because it all depends on the numbers. And our numbers, like I said, have dropped significantly. Is it the right timing? I personally would like us to hold the masks in school for a little longer. I think if once we get out of February, I think we're going to have a lot more information about how things are going. And I'm really very hopeful that March, April, this spring, that we'll hopefully be getting back to a much more normal life, knock on wood, that no crazy variant comes into play. I'm hoping that we will be able to lift things and get back into a more normal life. It is a tough question whether now's the time here. It all depends on a lot of public health measures, how things are going in hospitals and the ERs. So if things are right in your area, it's probably okay to start loosening things up.
And again, person, a teacher or a student can wear a mask. They just don't have to wear a mask. So maybe.
Yes, and there's a big question to say, well, if it's one person wearing a mask, how protective is that? I think it's protective. It's helpful. And I have come from a family with a lot of teachers in my family. I think they're going to continue to wear masks for a while. But there's a tough thing with kids, how we don't really even know enough about the mask wearing and how that's impacted them even socially. We have to recognize that there's been a big social impact on kids in COVID to begin with, between the year where we were really quarantining a lot. They did homeschool. The impact on kids has been tremendous. Every teacher I talk to, and I talk to a lot of them, they talk about, the third graders are really acting like second graders, and fourth graders are acting like third graders. And it's really trying to get them up to where they were before. I've had teachers tell me that socially, that the kids don't even remember to line up in school, or the general rules of school. And they took a good half of the year trying to reinforce the general way to comport yourself in school, that kids were not with it for that. So anything that can get kids back to normal is going to be a good thing. And we remember, even with Omicron, we did not have a lot of school transmission. So, if we can loosen things up at what time, that's for the public health people to decide. Anytime we can get things back to more normal for kids, I'm pretty much for it. I think we have to recognize the anxiety and mental health issues that we've had with kids. Kids have been dramatically impacted by this pandemic.
Yeah, and it's interesting you just brought those terms up, because I believe Gloucester just got a $120,000 grant to screen students for substance abuse and anxiety issues.
Yes, I saw that. That's wonderful, and kudos for that. It is tough right now because we can't, every place you can talk to that takes kids for mental health reasons, psychologists, therapists, all the groups are full. There's waiting lists. It's very hard to get kids in for screenings. So this will be any help, any money is coming in that way is going to be helpful. Yeah.
And I think the governor did commit $400 million to behavioral health across the state. Wow. All ages, I think. So there's definitely movement there. So to that point, looking forward, what about the possibility of this being endemic? That this is just, and what are the implications for children and how we take care of them going forward in an endemic situation, or even how we go forward with them as injured. I shouldn't say that, as how we take care of these children that have dealt with this pandemic going forward.
Mm-hmm. So the endemic, remember, we have endemic illnesses every year, right? We have the flu that is passed around, and we have people die of the flu every year, and we get our flu shots. And so when we talk about COVID becoming endemic, it's going to be hopefully passed around, and we'll get it and we'll pass it around. But we have our illness at home, and it's pretty benign, and we're fine. Hopefully we'll have enough home tests. If you're ill with it, you stay home. Just like if you're ill with the flu, stay home till you're better, and then you go back to the world. So I think there may be shots for COVID going forward, boosters going forward, depending on what variants come out. I think there maybe have to have changes for the vaccines over time, and we should accept that. People talk about negatively about the vaccine, but look, the flu vaccine has been around for a while, and year after year, The flu vaccine does what the COVID vaccine has been doing for Omicron or for Delta. It's done the same thing. It didn't prevent the people from getting the illness totally, but it did largely prevent people from being in the hospital, going to the ER, or being in the ICU, or dying from COVID. It prevented those kind of things. And that's what the flu shot does every year. If you look at the statistics for the flu every year, the people who die of the flu are largely unimmunized with flu vaccine. So the flu vaccine doesn't prevent the flu, but it will prevent really serious flu. And so that's why we get the flu shot. So it's going to be the same thing with COVID, we hope, that you get a flu shot perhaps every year, perhaps you get a COVID shot every year. And then you're going to be protected from whatever variant, at least for a severe illness, from whatever variant comes forward that year. And there may be changes that with COVID, that you get a bad variant around, and we'll have to respond to it. But the hope is that the COVID variants will get less serious over time. They'll still be around, but it will be like something like the flu or a bad cold, and we don't have to worry about it so much. Having said that, there will be some people that might be much more susceptible to severe illness from COVID, just like they are susceptible to severe illness from the flu. And they will have to take more precautions perhaps, and maybe they're the ones who really will have to be targeted for the vaccine. As far as taking care of the kids going forward, you know, I think we have to get back to more normal, right? I think we have to get kids outside. I think we have to get kids in groups. What we've seen in practice for a while, we were doing videos and talking to parents saying, hey, screen time, don't worry about it. School's on screen time. Let them have screen time, you know, play with their friends on video games. Let them do what, you know, at this point, I would say have too many kids on screens and staying on screens. And now it's time to get them outside, get them with groups, get back into activities. I have had families who are very hesitant and fairly hesitant to get back into group activities. But I think getting kids to Friday night fun at the Y or any other group activities, it's good for them. I think people have to get out of our shells that we've created from COVID.
And lastly, Dr. Orr, should parents and children just remain steadfast in taking these precautionary measures right now? And at what point does a parent recognize symptoms in a child and should contact a pediatrician?
Yeah. So, you know, I think we're still in the game that we still have to contact almost anybody getting ill. Will have to get some screening for COVID still. I think we still have to have some precautions. I'm still going to be wearing masks at the Y. I go work out at the Y and I wear a mask, and I go to the store, I'm wearing a mask in the stores, and I'll be doing that for a while. I think I'm waiting to see what happens at the end of this month into March. Where are our numbers? What's it looking like then? And then I think I might feel more comfortable relaxing if the numbers are really dropping down to pre-pandemic levels. And if that's the case, then we can all start relaxing. But for now, in this month of February, I would still be a little bit cautious. I think I'd still have family members wearing masks in public places, especially indoors. At the same time, I would try to get them into some activities with other kids at the same time, because I think we have to start opening up, and it takes a little time to do that. So,
Well said.
Thank you so much for talking to us today. And let's hope that we can speak to you in a month or so and it's all good news.
let's hope that. Let's all hope that.
Right?
My fingers are crossed here.
I do have to say, I'm having all these, you know, these deja vus that we had that conversation a year and a half ago, you know.
Yes.
We
Yeah,
did.
I know.
Oh,
Look at what we've been through. Oh my gosh, look at what we've been through.
It's amazing. Yeah.
Waves and variants but at this point, I'm hoping that I'm really hoping that we're getting past the brunt of this pandemic and that we will be getting to a more endemic virus that we have to just live with. I'm hoping that we're getting there.
Dr. Brian Orr, thanks again for your time. I really appreciate it. And yeah, let's touch base by springtime and see how those numbers are.
That's great. Let's do that. Let's do it.
Right. Thank you so much.
All right. Thank you.
This episode of Cape Ann Today is brought to you by J&L Welding.
Interested in a sponsorship? Email sponsor@1623studios.org to learn more.